improvement in the treatment group compared to the placebo group. And now we can see from the latest data release that after a second year on drug, the children who were in the treatment arm, that response was sustained, and the data that BioMarin have released this morning shows that the year 2 annualized growth velocity was comparable to the year 1 growth velocity, and there was a statistically significant difference in the growth of the children on the treatment arm versus placebo to the tune of less than 0.0001. So that is impressively statistically significant.
Right. So the second year data, growth velocity was slightly different. AGV was slightly different from year 1. I think it's because 6 children from year 1, they were not included in the second year data. So, in order to have an apples to apples comparison, I think BioMarin uses same number of, same children who have data available for second year. So, I find it a little bit interesting that we recently had a discussion with the BioMarin. Actually, last week we asked the company because second year children are 1 year older than the data that was generated at year 1. So BioMarin said that the natural history data indicates that as the children grow age, there is about 0.2 centimeter per year decline in AGV. So we kind of thought that maybe 0.2 centimeter per year decline from year 1 would be reasonable, but it's actually about the same. So can you talk about your view of similar data, similar AGV in year 1 and year 2, and why it's not necessarily reflected the natural history data showing 0.2 centimeter per year decline?
Yes, I think the most reasonable answer to that is growth can be quite a movable feast that sometimes does things slightly unusual, and especially, as you say, if you're changing the numbers of participants, then that can impact the overall effect. But I think that the key thing to take home from this is we were looking at the phase 2 data, and we could see a slight decline in the annualized growth velocity, and we now know that the reason for that is not because the response is becoming less sustained and that there's tachyphylaxis or a lack of response to the drug over a period of time. It's because, as the natural history data has shown us, that there is this steady decline of AGV as the children get older. So the fact that it's actually gone up is really encouraging.
Yes, and then the fact that in second year the treatment effect is sustained, as well as when you look at placebo children crossed over to vosoritide during the second year, actually shows kind of like implies a similar growth of velocity. So based on that and kind of looking at earlier phase 2 data in 10 patients out to many years, how do you? Do you think that vosoritide would have at least based on what you say, the multiple year of effect, not waning effect?
Sorry. You didn't say your question. The final bit of your question again.
The question is, in phase 2, you went out to, I think, many months. You went out to 54 months. And then phase 3 data, much larger patient population, close to 120, you see sustained growth of velocity at year 2 versus year 1. So does that give you increased confidence that vosoritide treatment effect is going to be sustained for as long as the treatment goes